Now that President Trump has signed the Big Beautiful Bill Act into law, many in mid-Michigan are now wondering how it'll affect them, specifically when it comes to receiving mental health coverage due to looming new regulations on Medicaid. 6 News reporter Zach Preece spoke to advocates and health professionals today to get some answers. He's here for you now live from the studio with the story. Good evening, Zach.
Jorma, supporters of the bill celebrate its focus on public spending and border security, while Democrats bash what they say will be a disastrous slashing of social programs like Medicaid. The Michigan League for Public Policy says about 2.6 million Michiganders currently rely on Medicaid.
We know with the added work requirements, eligibility checks, plus provider taxes, that there will be less dollars available in order to pay for this critical care for Michiganders.
That work requirement will require people aged 19 through 64 to work, volunteer, or go to school for 80 hours a month, with limited exceptions. Monique Stanton, the organization's president, says Medicaid plays a big role in mental health coverage.
Medicaid is the biggest payer for behavioral health services in Michigan, and that includes substance use disorder services, services for individuals with mental health conditions, and services for individuals with developmental disability.
Lansing Congressman Tom Barrett said in a statement to 6 News that the law allows Medicaid to continue serving the most vulnerable Americans it was intended to serve. Some also worry that less people on Medicaid could leave hospitals struggling to make as much money.
For Michigan hospitals, that means in the same 10-year period, we expect a reduction in reimbursement of more than $6 billion.
And Stanton worries that healthcare professionals may leave the field altogether due to an overbearing amount of paperwork associated with eligibility checks and work requirements.
And the number one reason when people conduct exit interviews about why they're leaving the field, specifically the publicly funded field, is because of paperwork. It's going to make it even more difficult to retain highly skilled and critical staff.
And Appel acknowledges that the now law does provide a rural fund, but she doesn't think that it'll be enough to make up for the money lost by rural hospitals. She worries services like labor and delivery could become unavailable at certain hospitals because they are simply too expensive.